So let's get started, and we'll ask each speaker to briefly answer a question a number of you had in common. What is a best practice we can transfer to our own tech transfer programs, be they small molecules, biologics, cell and gene, or other? Bikash, perhaps, can you start us off?
Sure. Very good question. I think it's an extraordinary time that we're living in, and the advances that have been made on the vaccine side and the learnings that we are gathering from that in terms of how we can move products more quickly to market, hopefully successfully at the end of this journey, certainly is applicable to other dosage forms and other manufacturing processes. I think one of the key things to moving quickly and having the confidence that you're making the right steps is to look at the analytical method transfer activity. Oftentimes, this is a step in the overall tech transfer journey, but having confidence in your ability to review the data, make decisions on the data that you're getting. If you're using a CDMO, for example, or an external partner in which there's sophisticated methods that are being transferred. And it doesn't need to be a vaccine or a cell and gene therapy product. It can be a solid dose tablet, a modified dose, or an extended release tablet that's got a novel processing with it. The ability to have confidence in that data as you're doing your tech transfer exercises and characterization exercises is really important to making sure you're making good decisions and you're not having to do some do-overs.
Okay, very good. That's a good start. Maybe we'll hand it over to Marcelo. And Marcelo, as we prepared for this panel, you were adamant about the point that our participants need to understand that every tech transfer is different. So what can our viewers do about all that? How would you start us off?
Yeah, sure. Well, thank you, and good afternoon or good morning, depending on where you are. Very glad to be here today. So certainly, as I say, every tech transfer is going to be different, and there are going to be things that are going to happen. And so how you plan for those contingencies are so crucial in order to mitigate not only the quality of the product and transfer, but also timing. But the one point, after Bikash so rightly brought up the analytical, is really not to underestimate the need for transferring site support during execution as well as the testing phase. And that applies to whether it's an internal transfer to a site, that's a site-to-site transfer, or it is from an internal company to a CDMO. Things are always going to go wrong, and there's always that real-time decision-making that perhaps is not written down in a guideline or a piece of paper, a batch record that needs to be discussed and mitigated. So having that site or SME support there during that can really avoid a lot of delays in timing that can ultimately affect the speed of the transfer.
Okay, very, very good. So we have 2 points for the analytical side of things, and I know that OutsourcePharma.com readers and participants have understood for a long time that analytical services support has been something that for all projects that we can think of is growing more and more in importance as some of these products become more complicated.